Turning to technology, from diagnosing urological cancers to predicting patient outcomes, the use of artificial intelligence within the field of urology is becoming more commonplace by the day, like it or not. Here to discuss the pros and the cons is Dr. Andrew Hung. Pleasure to have you joining us today.
Thanks for having me.
Let's get started. Can you kind of boil down some of the ways that AI or machine learning can be used by urologists?
Sure. From diagnosing cancers or urologic conditions to treating them, to after treatment figuring out how to manage patients and predict, let's say, recurrence of disease. Those are all areas ripe for AI to play a role.
So there are a myriad of ways.
Absolutely.
There are some concerns. Can we place our full trust in AI? What do you say?
I would say not yet.
Okay.
Today, there's not a lot of AI used in clinical practice yet, but I think there's big changes that are going to happen where there are going to be specific areas where physicians can utilize AI to enhance how they do care. It's not going to happen overnight, and it's not going to be for every area of urology, for instance. It's going to be in select areas where it can enhance how physicians treat, how we take care of problems, how we engage with our patients, and how we manage diseases. And it's something that's going to have to be done very carefully. We're still going to have to use the scientific rigor that we do with any new technology that we adopt. But there will be areas where AI will be a part of patient care.
You touched on this a minute ago, but are there varying levels of reliability with AI when it comes to where you might want to implement it within your practice?
Yeah, when you train models, it's going to give you a sense of the performance of how the models perform. And depending on what the data set is that you're looking at, depending on what the modality, for instance, is it radiology, is it pathology, is it MRIs or CT scans, and what exactly is the clinical question you're looking at, the performances of these models, they vary greatly. And how well are they tested? Are they tested in an environment where it's at a singular hospital and it only works for one patient, or is it across many different hospitals, across different continents, and so forth? And so there is tremendous variability in how robust these models have been vetted.
Okay.
And really, we're looking for the best. We're looking for models that will not only assess well for patients at a given hospital, but really will assess any patient across the board. So, that's remains to be seen in many areas, but that's the rigor that has to happen to ensure that these models are actually safe and ready for clinical use.
So as a physician, what excites you the most about the future of AI?
I see AI as an opportunity for us to enhance patient care. Physicians are humans. We are all humans. We do make mistakes. Take, for instance, surgical performance. There is wide variability in terms of the performance of surgeons. And can we narrow that performance gap? Yes, I think so. And I think AI can play that role. So it's not going to replace surgeons, for instance, but it may help us elevate all surgeons so that we all perform at a higher standard.
There was a recent article published by NIH that essentially says AI is here to stay, like it or not. And it alluded to the fact that for physicians that are hesitant and reluctant to implement AI in their practice, they're going to end up falling behind. What do you say to that?
I would say that AI is a technology to stay, whether we like it or not, and it behooves us to understand, what are its strengths, what are its capabilities, but also understand what their limitations are, and understand where humans will always still play a role, and really just understanding how it fits into that ecosystem. So I don't think physicians are going to get lost, and we're going to keep our jobs.
Wonderful. Well, Dr. Hung, thank you so much for your expertise today and for your time.
Thanks for having me.